next one under the symptoms and conditions is broth. Broth is an abnormal sound heard in auscultation. So what is auscultation? Auscultation is a method used to listen to the sound of the body during physical examination by using a stethoscope. So I think most of us here alam kung ano naman yung stethoscope. Diba ito yung ginagamit ng mga doktor para pakinggan yung heartbeats natin or para pakinggan kung may kakaiba bang sound na naproproduce yung heart natin. So when there is a heart murmur, pwede siyang blowing, whooshing, or rasping. That's what you call broth. So next is cardiac tamponade, a pathologic accumulation of fluids in the pericardial sac. May result from pericarditis or injury to the heart or great vessels. So to simplify, it happens when extra fluid builds in the space around the heart. So since our heart sits inside the pericardium, pag nasugatan siya or na-rupture, pwedeng pumasok yung fluids doon and yun yung magkakos ng cardiac tamponade. So ito, yung ating pericardial sac. So for example, this can occur when a trauma happens in the chest like stab wound. It can puncture a blood vessel, then the pericardial sac can be filled with blood. Now let's move on to ectopic beat, a heartbeat that originates from some parts of the heart other than the SA nodes. The SA nodes are sinoatrial nodes, the natural pacemaker. So this happens when the heart beats too soon. It can feel like your heartbeat skipped or racing. So this can be felt as palpitation. So yung mga mahilig magkape dyan, ang madalas nakaka-experience nitong ectopic beats. So when there's an extra strong heartbeat, but it is just momentarily. So pabigla-bigla lang siya and saglit lang. Hindi siya yung tuloy-tuloy. So these ectopic beats can be in quick succession. So for example, ito yung heartbeat natin na normal. Dab, dab, dab. So ectopic beats can occur like this. Dab, 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 dab. Then dab, dab, then back to normal siya. So, pwede din siyang quick succession like this. Dab, 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 1, 2, 3. Then, balik na ulit siya. Titigil na siya ulit. And then, after few minutes, mag-occur ulit siya. So, that's ectopic beat. So, next, extrasystole, a premature heart contraction that occurs separately from the normal beat and originates from a part of the heart other than the SA nodes. So it is a heartbeat outside the normal rhythm, as often occurs in normal individuals. So kahit kanino pwede itong mag-occur unexpectedly. But this often happens to individuals who experience anxiety, stress, fatigue, or generally unwell. Though it may disappear through physical activities or exercises. So, pwede natin maiwasan ang pagkakaroon nitong extrasystole kapag tayo ay mag-exercise, magkaroon ng healthy living. So, next is flutter, a very rapid 200 to 300 beats per minute but regular contraction, as in atria or node ventricles. It is an abnormal heart rhythm. It occurs when a short circuit in the heart causes the upper chamber's atria to pump very rapidly. So this occurs when there is no proper coordination sa chambers ng ating heart and mas nagbibit or nagkakaroon ng improper beat sa ating atria. That's flutter.
Next po, hypotension. First, let's define what is hypotension. Hypotension is a condition of lower than normal blood pressure or tinatawag din po ito as low blood pressure. Now for instance, the normal blood pressure for most adults is defined as a systolic pressure of less than 120 and a diastolic pressure of less than 80. Now, let's define what is systolic and diastolic na ba. Systolic, ito yung nagme-measure ng pressure in your arteries when your heart beats. Then, ang diastolic po is also measure the pressure in your arteries when your heart rests between beats. Yun po yung pagkakaiba nun. Systolic, when your heart beats. And diastolic, when your heart rests between beats. And nakukuha po natin yan by using the apparatus po, the sphygmomanometer. Now, proceed to kapag ang blood pressure is below 90 and systolic is sometimes sinasabi na nating low blood pressure. But it should be yung tinatawag na symptoms, for example, 90/60. There is two types po kasi, the very acute or orthostatic and the long term. After so many hours, bigla siyang bababa. Now question, hindi ba lahat nakakaramdam agad ng mga effects ng low blood pressure? Like what I said, kung ang blood pressure mo is normally between 90 to 80 systolic and diastolic and wala kang nararamdaman, okay lang yon. Pero kapag bago itong nararamdaman, bago mo nalaman na yung blood pressure mo below 90, dati 120 ka, tapos nag-80, may nararamdaman ka, yan yung di okay. So ano nga dapat yung mararamdaman? Kalimitan kapag may blood pressure ka, yung blood flow to the brain is low, meaning mahina yung dating ng blood sa ating utak. Ngayon, magkakaroon ng lightheadedness, yung iba is parang fainting, yung iba nawawalan ng malay or very acute it, tinatawag na orthostatic potential. Pwedeng mawalan siya ng malay. Another question, paano po kung walang available na aparatus para malaman na yung blood pressure mo is mababa? Then, nakakaramdam ka na din ng hindi normal. Then, if you want to check, pwede din naman sa pulso mo or sa pulse rate. If mababa yung pulso mo, then better to go to sa pinakamalapit na clinic sa inyo para mag-guide kayo sa gagawin nyo. Then, next is intermittent claudication. So, this is the pain in muscle during exercise caused by inadequate blood supply. The pain disappears with rest. So, mostly lower extremities yung madalas na nakakaramdam tayo ng ganito. Like hips, knee, ankle, joint, and the bones of the thigh, legs, and foot. Now, question, why does this happen? Because our lower extremities don't have any oxygenated blood flow. So, this is the peripheral arteries disease problem. Next is mitral valve prolapse. So, this is the movement of the mitral valve cups into the left atrium when the ventricles contact. Ito po is nakikita karamihan sa mga kababaihan. And ang mitral valve po kasi is kailangang sarado lang, just like this, for example. Now, may papakita akong pictures where parang lumundo, yan. Hindi yan normal. Pwedeng bumalik yung dugo pataas. Yan ang mitral valve prolapse, pataas. So, symptoms are anxiety, panic attacks, arrhythmias, exercise intolerance, palpitation, atypical chest pain, and fatigue. Pwede rin yung fatigue, orthostatic, syncope or prescope, or yung parang magko-collapse, ganun. Next, occlusive vascular disease. It is arteriosclerotic disease of the vessels. Usually peripheral vessels. So, it is a condition where mayroong pagbara sa mga blood vessels, lalo na sa arteries, na maaaring magresulta sa hindi sapat na daloy ng dugo. Next is palpitation. What is palpitation po ba? Palpitation is a sensation of abnormally rapid or irregular heartbeat. Now, may dalawang cause, the metabolic and mechanical. Mechanical cause, mismong doon sa mekanismo ng puso natin. Metabolic cause, may condition din na pwedeng mag-cause ng palpitation, just like thyroid disease. Now, ano nga ba ang sanhi ng palpitation? Problem sa sirkulasyon at nagdudulot ng arrhythmia or irregular sa tibok ng ating puso. Now, question, nagko-cause ba ng palpitation ang coffee or kape? Yes, tama po. Kasi ang coffee is caffeine, which is stimulant, lalo na kung sobra, and sometimes can also serve as protective mechanism ang ginagawa ng acting katawan kung mayroong isang anemia ang isang tao at nagkulang ng daloy ng dugo at hangin sa ating puso na nagko-cause rin ng palpitation.
Next is Raynaud disease. When part of your body is exposed to extreme cold temperature, it will result to a muscle cramp since the area affected limits the blood flow, and it is also the response of blood vessel to a cold temperature. The next one is pitting edema. It is the excess fluid buildup in the body causing swelling. If you have a swollen area, for example, this is your leg, and you have a swollen area here, you put pressure to that area, it will create a hole, since fitting edema came from a word hole. The third one is polyarteries nodosa, or usually known as PAN. It is the family of rare disease, usually vasculitis. And we say vasculitis, it is the inflammation of our blood vessels. And when our blood vessel is inflamed, it will restrict blood from flowing to different parts of our body, and it will damage our vital signs and tissues. Usually, it is seen to our lower extremities, such as our pelvic down to our toes. The last one is regurgitation, or also called as aortic regurgitation. It is a type of heart valve disease, and it usually happens when the valve between artery and the heart chamber doesn't close tightly, so it will result to a backward leakage of the blood.
So next, we have the subacute bacterial endocarditis. What is endocarditis? So endocarditis is the inflammation of the inside lining of the heart valves and our heart chambers. So this subacute bacterial endocarditis, this is a type of infective endocarditis. It is an infection that occurs when germs such as bacteria enters the bloodstream and attack the lining of our heart valves. Next, we have the tetralogy of Fallot. Tetralogy of Fallot, usually po is sa mga baby po ito. This is a birth defect that affects normal blood flow through the heart. Tetralogy of Fallot happens when a baby's heart does not form correctly as the baby grows and develops in the mother's womb during the pregnancy stage. So, one symptom po ng TOF natin or tetralogy of Fallot is the cyanosis. So, cyanosis is when the skin, lips, and nail beds are bluish in color because oxygen, poor blood, is being pumped throughout the body. Next, we have the thromboangiitis obliterans. This is also called as the Buerger's disease. This is a rare disease of the arteries and veins in the arms and legs. Dito po kasi sa Buerger's disease, blood vessels become blocked. So because of this, blood clots may form in the blood vessels. Then, the lack of blood flow destroys the skin tissue that can lead to infection and death of the body tissue, called the gangrene. So this gangrene po, this is a dangerous and potentially fatal condition that happens when the blood flow of a large area of tissue is cut off. So when we say fatal, nakakamatay po. So sino po ang mga tinatamaan nitong thromboangiitis obliterans? Ito po yung mga tao or taong laging, let's say, madalas manigarilyo or the use of other forms of tobacco. So, the only way po para matigil ang thromboangiitis obliterans is to quit smoking or quit in any form of tobacco. For those who don't quit naman, this can lead to surgery or removal of fingers and toes. So next, we have the vegetation. This vegetation, connected po siya sa subacute bacterial endocarditis, which is nauna ko nang nabanggit kanina. Itong subacute bacterial endocarditis po kasi, this causes growths on the heart valves. Itong growths naman na to sa heart valves natin, ito na yung tinatawag nating vegetations. So ano nga ba ang vegetation? Irregular bacterial outgrowth of the heart valve associated with rheumatic fever. So these vegetations po can cause holes in the valves and can cause the infection to spread outside of the heart and the blood vessels. Lastly, we have the Wolff-Parkinson's-White syndrome. So this is a cardiac arrhythmia consisting of tachycardia and a premature ventricular beat caused by an alternative conduction pathway. So when we say heart arrhythmia, this occurs when the electrical signals that tell the heart to beat don't work properly. So sa heart arrhythmia po, pwedeng mabagal or pwede rin mabilis ang tibok ng puso natin. So balik po tayo dito sa Wolff-Parkinson's-White syndrome. this condition is present at birth already, and it is a fairly rare condition. So dito po kasi sa syndrome na ito, an extra signaling pathway between the heart's upper and lower chambers causes a fast heartbeat, or what we call the tachycardia. So this condition usually aren't life-threatening, pero rarely po, Wolff-Parkinson's White syndrome can lead to sudden cardiac death, especially in children and in young adults.
Ablation, removal or destruction. In cardiac ablation, a catheter is used to destroy a portion of the heart's conduction pathway to correct an arrhythmia. Ablation is a procedure is often used to correct arrhythmias, irregular heartbeats that can cause issues with the heart's rhythm. By precisely destroying the problematic tissue, cardiac ablation aims to restore a normal and coordinated heartbeat. Angioplasty is a procedure that reopens a narrowed vessel and restores blood flow, commonly accomplished by surgically removing plug, inflating a balloon within a vessel, or installing a device or stent to keep the vessel open. Angioplasty is often necessary when arteries become clogged with the plaque, leading to reduced blood circulation. And we have different methods for angioplasty. First, we have balloon angioplasty. Balloon angioplasty is a deflated balloon inserted to the narrowed vessel and then inflated to compress the plug against the vessel walls, widening the passage. Second, we have the stent placement. A stent is a small mesh-like tube may be placed within the narrowed vessel to provide structural support and keep it open. This prevents the vessels from collapsing and helps maintain insufficient blood flow. Next, we have artificial pacemaker. Artificial pacemaker is a battery-operated device that generates electrical impulses to regulate the heartbeat. It may be external or implanted, may be designed to respond to need, and may have capacity to prevent tachycardia. Here's an example. If someone has a bradycardia or slow heartbeat, a pacemaker can send electrical signals to stimulate the heartbeat at a normal rate, ensuring sufficient blood flow throughout the body. This device can be implanted surgically and be designed to function based on the individual's needs, preventing the issues like tachycardia or excessively fast heartbeat by maintaining a steady rhythm. Next, you have cardiopulmonary resuscitation, or CPR. Is the restoration of cardiac output and pulmonary ventilation after cardiac arrest using artificial respiration and chest compression or cardiac massage. CPR is an emergency procedure used to revive a person whose heartbeat has stopped beating. It involves combination of chest compression and artificial ventilation to maintain blood flow and oxygenation to vital organs. For example, if someone collapses and it's unresponsive, CPR involves performing chest compression to keep the blood circulating and rescue breaths to provide oxygen until medical help arrives. This action aims to restore the heart's function and prevent the brain damage due to the lack of oxygen. CPR is crucial in saving lives during cardiac arrest situation. Next, we have cardiovention. Cardiovention is a correction of the abnormal cardiac rhythm may be accomplished pharmacologically with arrhythmic drugs by application of electric current. Cardiovention is a medical procedure used to restore a normal heart rhythm in individuals experiencing abnormal heart rhythms, such as atrial fibrillation or flutter. It can be achieved either through medication, using arrhythmic drugs, by applying an electric current, the chest known as electrical cardiovention. For example, in electric cardiovention, pads and paddles are placed in the chest and a controlled electric shock is delivered to the heart. This shock interrupting the abnormal rhythm, allowing the heart's natural pacemaker to restore a normal coordinated heartbeat. Medications, on the other hand, work to regulate the heart's rhythm without the use of electric shock. Both methods aims to correct irregular heart rhythms and restore the heart's normal function.
Coronary angiography. Radiographic study of the coronary arteries after introduction of an opaque dye by means of a catheter threaded through blood vessels into the heart. Coronary angiography is a procedure that uses a special dye and X-rays to see how blood flows through the arteries in your heart. Coronary angiography is performed to detect obstructions in the coronary arteries of the heart. Coronary artery bypass graft, surgical creation of a shunt to bypass a blocked coronary artery. The aorta is connected to a point past the obstruction with another vessel or a piece of another vessel, usually the left internal mammary artery or part of the leg of the saphenous vein. Coronary artery bypass graft is a surgical procedure used to treat coronary heart disease. It diverts blood around narrowed or clogged part of the major arteries to improve blood flow and oxygen support to the heart. Coronary calcium scan method for visualizing vessels, narrowing calcium deposits in coronary arteries. Useful for diagnosing coronary artery disease in people at moderate risk or those who have undiagnosed chest pain. A coronary calcium scan is a special computerized tomography scan of the heart. It looks for calcium deposits in the heart arteries. A buildup of calcium can narrow the arteries and reduce blood flow to the heart. Coronary calcium scan may show coronary artery disease before you have symptoms. Creatine kinase MB. Enzymes released in increased amounts from cardiac muscle cells following myocardial infarction. Serum assays helps diagnose MI and determine the extent of muscle damage. The CKMB test is a blood test that looks for special enzymes. The enzyme CKMB or creatine kinase myocardial band is most common in your heart but can also mean you have damage to other muscles in your body. The use of this test has decreased because of newer tests that have a better ability to detect heart damage only.
CT angiography used to visualize our blood vessels in various of the part of our body. It's also involved the CT scanner which combines X-ray and computer technology to create details and images of our blood vessels. Karaniwan ginagamit ang CT angiography upang ma-diagnose ang mga kondisyon tulad ng arterial stenosis. Ito din ay nagbibigay ng mahalagang impormasyon sa mga doktor para sa planong gamot o operasyon.
Defibrillation.
Ay isang electrical shock sa ating puso o yung biglaang paghinto ng ating puso. Ito ay kadalasang ginagamit sa emergency room tulad ng cardiac arrest. Echocardiography naman ay ito yung tinutukoy niya kung ano ang sakit ng isang tao sa puso or kondisyon na may ugnayan sa puso. Ultrasonic wave, ito yung madalas silang ginagamit upang suriin o tignan kung ano ang nasa loob ng ating puso or yung paggalaw ng ating dugo. Lipoprotein. Ito naman ay yung napapaligiran ng taba or lipid sa ating puso. Ito ay nakakapekto sa ating kalusugan tulad ng cardiovascular system.
May 4 na iba't ibang uri ng lipoprotein. Ito ang high-density lipoprotein. Ito ay madalas na tinatawag na magandang kolesterol mula sa dugo at dala ito papunta sa atay para sa pagproseso at pagtanggal mula sa katawan. At ang isa naman ay tinatawag na low-density lipoprotein. Ito naman ay kilala bilang masamang kolesterol. Maaaring nagdulot ito ng pagbubuo ng plaka sa mga arteries na nagdadala ng sakit sa puso at cardiovascular. At ang isa naman ay tinatawag na very low density lipoprotein. Nagdadala ng triglycerides mula sa atay patungo sa iba't ibang bahagi ng katawan. At ang last naman ay chylomicrons. Ito naman ay malaking bahagi ng lipoprotein na nagdadala ng mga taba mula sa mga kinakain na pagkain mula sa bituka patungo sa iba't ibang bahagi ng katawan.
Percutaneous transluminal coronary angioplasty or the PTCA. It is a dilatation of a sclerotic blood vessel by means of balloon catheter inserted into the vessel and then inflated to flatten plaque against the arterial wall. A PTCA is a minimally invasive procedure that opens blocked coronary arteries to improve blood flow to the heart muscle. To begin the procedure, the doctor will numb the skin in your groin. A needle will be placed through your skin and into the femoral artery. Next, a flexible guide wire will be passed through the needle into your artery. Then the needle will be withdrawn. It will be exchanged for a small flexible tube called a sheath. This permits access into your artery. You may feel pressure when the doctor inserts the sheath, but you will not feel it moving inside your artery. Next, the guide wire will be advanced up to your heart. A flexible tube called a catheter will be advanced over the wire to your coronary arteries. The progress of the procedure will be checked with an X-ray device called the fluoroscope. At this point, your doctor will remove the guide wire. Then the doctor will move the tip of the catheter just inside the coronary artery to be examined. A special dye will be injected into the artery. This allows your doctor to view it better with the fluoroscope. The dye will make any blockages in the artery stand out. If a significant blockage is found, your doctor will insert a guide wire into the artery. A balloon on the tip of the catheter will be moved along the wire to the blockage. When the balloon inflates, it will expand the artery and improve the blood flow. You may feel some chest discomfort while this is happening. After this, your doctor will deflate and remove the balloon. A stent. A small metal device in the shape of a coil or slotted tube that is placed inside an artery to keep the vessel open after a balloon angioplasty. If you have a blocked artery in your heart, legs, or neck, you may need a stent to keep your blood flowing to prevent serious problems. A stent is left in permanently. These tiny but vital devices can hold the artery open in an area where you have a narrowing. They are inserted in an angioplasty procedure, either as an emergency to treat the heart attack or in a planned way to widen an artery that is being narrowed by a buildup of fatty plaque. Once it is in the right position, the balloon is inflated, widening the narrowed part of the artery and expanding the stent to fit the artery wall. Then, the catheter, balloon, and wire are removed, leaving the stent in place. This procedure usually takes 30 to 60 minutes. Stress test. It is an evaluation of physical fitness by continuous ECG monitoring during exercise. In a thallium stress test, a radioactive isotope of thallium is administered to trace blood flow through the heart during exercise. Imagine you were a patient. During your cardiac exercise stress test, you'll walk on a treadmill or cycle on an exercise bike until you reach your target heart rate, which is 85% of the maximum heart rate predicted for your age. Every 3 minutes, the speed, incline, and resistance of your treadmill or bike will increase up to 15 minutes maximum. After you complete the stress test, you'll be monitored until your heart returns to its normal resting rate, which ranges from 60 to 100 beats per minute. Your test result will be explained to you, and your doctor may recommend additional tests and treatments. Troponin, a protein in muscle cells that regulates contraction. Increased serum levels, primarily in the forms of troponin T and troponin I, indicate recent myocardial infarction. Normally, troponin levels in blood are so low that only the most sensitive types of tests can measure them. But if your heart is damaged, troponin leaks into your bloodstream and your troponin blood levels will rise. Troponin testing is mainly used to help diagnose heart attacks. Heart attacks damage the heart by suddenly blocking the blood flow that brings oxygen to part of the heart muscle. Without oxygen from the blood, heart muscle cells die and release troponin. Troponin test results can confirm damage to the heart muscle from a heart attack. The more damage there is to the heart, the more troponin is released into the blood. So, measuring the amount of troponin in the blood can also help estimate how much of the heart has been damaged. Higher than normal troponin levels may also be found in other conditions that can damage the heart muscles.